The Delta variant continues to fuel a surge in COVID-19 here in Utah. For the first time in nearly 6 months, the Department of Health is reporting more than 1,000 cases in the past 24 hours. The UDOH reported 1,113 new cases Thursday, the first time Utah has topped 1,000 cases in a day since February 9th. 3 new fatalities raised our death toll to 2,450, with 353 people hospitalized with the virus throughout the state. Dr. Brandon Webb of Intermountain Healthcare says intensive care units are once again filling up with COVID patients.
The primarily older, high-risk population of the winter and last fall has really been replaced by a population that is largely unvaccinated and younger. We're seeing patients in their 30s and 40s, many of whom have obesity, for example, or other medical conditions, who are not vaccinated.
In a statement, Governor Spencer Cox said, quote, "Today's case count is another step in the wrong direction for our state, but we remain confident in vaccines to help us turn the tide. Unfortunately, nearly everyone who is getting sick and who will end up in the hospital because of today's case counts is unvaccinated. This pandemic of the unvaccinated is tragic because it is preventable. It has never been easier to get a vaccine. While we are encouraged by increases in vaccinations, we need more people to protect themselves and their families."
The pandemic is not over. This is a terrible disease that still affects people's lives and livelihoods. It's affecting more and more Utahns every day. The consequences are not limited to health only. They impact our society and community in many, many ways. With increasing case counts, we are now again in a position where we're going to have to face the possibility that social restrictions in different venues may be necessary to control the disease, to decrease hospitalizations, and decrease unnecessary death.
Healthcare workers administered 8,122 more vaccine doses in the past 24 hours, pushing the state's total to 3,009,594.